Hello everyone, you're watching sqadia.com and today we'll be discussing some endocrine disorders of the bone. You must be remembering, how can a bone have an endocrine disorders? Well, bone is not just an organ which has the ability to actually support our body and the organs. Actually, it's have a very much endocrine function as well. We'll be discussing certain disorders related with calcium and phosphate metabolism. In the first section, we'll be going through hypocalcemia. What are the causes of hypocalcemia, its clinical features, its investigations, and how to treat hypocalcemia. Although it's rare, but acute hypocalcemia is an emergency and has to be dealt with. Hypophosphatasia and hypercalcemia we will be going through their signs, symptoms, and their treatment in the second section. In the third section, we will be going through a disease called as hyperparathyroidism, which is actually the hyperfunctioning of parathyroid gland, leading to increased pH level in our body, its pathology, its clinical features, how to diagnose this disease, and eventually how to treat this disease, because itself hypercalcemia can be highly problematic for the patients. Now in the last section, and the fourth one, we'll be going through the hypercalcaemia of malignancy. There are so many tumors which actually secrete parathyroid related hormone, which acts like a parathyroid hormone in our body, thereby increasing the calcium level in our body, eventually leading to called as hypercalcemic crisis of malignancy. That hypercalcemic it can present acutely as well, leading to a very severe kind of an emergency called as hypercalcemic crisis of malignancy. Thank you very much. Keep watching sqadia.com.